Hello everyone. Today I'm here to talk to you about assessing and diagnosing substance abuse disorders. Alcoholism and drug addiction are diseases that do not know barriers of culture, language, race, socioeconomic status, or sex, male or female. The disease of addiction plagues every nation and every race. In our textbook, it is reported that at least 10 million Americans met criteria for mental health and substance abuse disorders in 1997. And when I looked up the current research, in 2010, 45.9 million adults aged 18 or older were identified as having a mental illness in the past year. Among those 45.9 million adults, 9.2 million adults met criteria for substance dependence or abuse. So those numbers are staggering, and that's why it's so important for us counselors, no matter what setting we work in, to be aware of how to assess and diagnose substance abuse disorders. Um, Whether we're in a clinical setting, or a school setting, or a hospital setting, we will see and be able to recognize substance abuse problems. If we're serving children in elementary school, we are likely to encounter the disease of addiction in the parents and the families of the children that we serve. So first we're going to begin with talking about what is assessment. Assessment, according to Webster's Dictionary, is a documented process that is used to evaluate, diagnose, and treat individuals. For clients suffering from addiction, there are several steps involved in the process of assessment, which we've read some about in our textbook. The first step of that process is a clinical interview. So when someone presents with a coming to see you, the clinical interview is a very important part, and to include substance abuse assessment in that assessment. This also can be called a biopsychosocial assessment. There are many terms for a clinical interview. During this interview, you're going to cover a lot of information with the client to get a clear picture of the presenting problem and the other issues involved in the client's life, and also how it has affected their life. So the first thing we're going to focus on is the presenting problem and what brought the client to treatment. You're going to ask about current use of alcohol or drugs, how long they've been using, the amount they've been using, the frequency they use. You're also going to talk about the history of substance use and if there's been any previous treatment, whether inpatient, outpatient, residential, whether they attend 12-step meetings, those kind of things. Also, you're going to want to talk about the medical history. We all know that the use of alcohol and drugs causes medical problems over time. You want to find out what the client's medical issues are, if there are any. You also want to discuss family history. Alcoholism and drug addiction are a genetic disorder and tend to run in families. They also tend to run in certain cultures. So you want to be aware of the family history of addiction, but also of any cultural issues that may affect the client with alcoholism and drug addiction. For example, we know that Native Americans have a high high rate of alcoholism in their culture. So those things are very important. You also are going to want to do a mental status exam. The mental status exam is going to tell you a lot about the client's presentation. You're going to go through, is the client alert and oriented to person, place, time, and situation? Are they hearing voices or seeing things that aren't really there? Does the client have thoughts about hurting himself or herself? Does the client have thoughts about hurting someone else? Or have they ever had thoughts like that? What is their affect like? Are they expressive or is it flat? What is their mood like? Are they depressed? Are they manic and talking nonstop? Those things are all important, so that's what you do in the mental status examination. You focus on what is the client's presentation with you, and also what is their current functioning level. There are also, you want to talk about consequences of addiction and anything that may, job loss, divorce, loss of family, loss of significant other, those kind of things that may be a result of an addiction or alcoholism. During the clinical interview, another important part of assessing a client is to have a screening instrument, and we've learned about some of those in our textbook. I was hoping that maybe we could do the SASE with you, but I wasn't able to do that because you have to order it. But we're going to do the audit together today. So it has high validity and reliability. But I think it's important that as counselors we're aware of our own substance use and whether or not that is an issue for us, but also to be familiar with screening instruments that we are comfortable with and that we can use with our clients. So I thought together today we could do an audit. The audit was developed and evaluated over a period of 2 decades, and it was developed by the World Health Organization. It has been found to provide an accurate measure of risk across gender, age, and cultures, which is sometimes very difficult for assessment instruments. It's hard to have them where they can be applicable in many cultures and not just attuned to one. It consists of 10 questions about recent alcohol use, alcohol dependence and symptoms, and alcohol-related problems. It was developed in 1989, like I said, by the World Health Organization. A large number of studies have been conducted worldwide regarding the audit. Cultural appropriateness and cross-national applicability were important considerations in the development of the audit. So it's good to use with all clients across cultures. A recent systematic review of the literature concluded that the audit is the best screening instrument for the whole range of alcohol problems in primary care, as compared to other screening instruments such as the cage and the mask. The audit has high reliability and validity. So we're going to go through the questions in the audit, so if you'll get a piece of paper and a pencil so that you can mark down your answers and you can score your assessment instrument. Okay, now we're going to do the audit. We're going to take this assessment together. The audit stands for the Alcohol Use Disorders Identification Test. So the first question, make sure you have a piece of paper and a pencil and you might write down your answers so you can score. The first question is, how often do you have a drink containing alcohol? Never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, 4 or more times per week. How often do you have a drink containing alcohol? The second question is, how many drinks containing alcohol do you have on a typical day when you are drinking? Never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, 4 or more times per week. Number 3, how often do you have 6 or more drinks on one occasion? Never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, 4 or more times per week. Number 4, how often during the last year have you found that you were not able to stop drinking once you had started? Never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, 4 or more times per week. Number 5, how often during the last year have you failed to do what was normally expected from you because of drinking? Never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, 4 or more times per week. Number 6, how often during the last year have you been unable to remember what happened the night before because you had been drinking? Never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, 4 or more times per week. Number 7, how often during the last year have you needed an alcoholic drink first thing in the morning to get yourself going after a night of heavy drinking? Never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, 4 or more times per week. Number 8. How often during the last year have you had a feeling of guilt or remorse after drinking? Never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, 4 or more times per week. Number 9. Have you or someone else been injured as a result of your drinking? Never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, 4 or more times per week. Number 10. Has a relative, friend, doctor, or another health professional expressed concern about your drinking or suggested you cut down? Never, monthly or less, 2 to 4 times per month, 2 to 3 times per week, 4 or more times per week. Okay, so those are the 10 questions. That's the end of the assessment. Now you're going to look at your answers, and if you checked never, there is no point. If you checked hold on just a second. Let's go back and if you checked monthly or less, that's 1 point. If you checked 2 to 4 times per month, that's 2 points. If you checked 2 to 3 times per week, that's 3 points. If you checked 4 or more times per week, that's 4 points. So you're going to do that for each question, and then you're going to add up your total. I'll give you a few minutes to take care of that. Score each answer based on the answer that you gave, then add up the total. If you scored 0 to 7, alcohol education is recommended. That's zone 1. If you scored 8 to 15, simple advice is needed. That's zone 2. That would be, your drinking is risky, and maybe make some changes in your drinking. And if you're working with a client in this zone, you would want to do the same. Maybe recommend that they attend a 12-step meeting just to kind of get a picture of what it's like and what addiction can and how it can progress and affect your life. If you scored 16 to 19, this is zone 3. This is when we get a little bit more concerned about drinking. We're going to give some simple advice, but also some brief counseling and continued monitoring to see how the drinking progresses or does not progress, and to see if you yourself or your client is able to cut down on the amount of drinking and control their drinking more. Zone 3 means that there's some problematic drinking going on. Zone 4, a score of 20 to 40, a person, you should seek treatment if you scored that personally. If you are seeing a client, then you, depending on the setting you're in, you can either make treatment recommendations, but they should always be referred to treatment. That might be right in your facility if you're working in an inpatient facility, but you should always refer to treatment if a client has a score of 20 to 40. So this is the audit, and it's an example of an assessment instrument that you would want to use with someone who is suspected of having a substance abuse issue. Particularly with this assessment, it's alcoholism. There are many other assessment instruments that can be used, such as the SASE, the MAST, and some of those that also are very useful to use when you're assessing a client. With substance abuse, it's very important to use an assessment instrument because most often we find that people are guarded about their use and maybe not always completely honest about the extent of their use and the consequences to that use.